What are two indicators that suggest that your lumbar disc herniation might be able to heal without surgery? That's what I'm going to talk about in this video. Hey, it's Dr. Matt, physical therapist. Okay, a lumbar disc herniation happens when the cushion between your vertebrae can either bulge or rupture, and that disc material ends up pushing on the nerves in your low back, and it can cause numbness, weakness, tingling, all sorts of symptoms, either in your low back or down your legs. That can be a very painful process. The good news is that just because you have a lumbar disc herniation doesn't necessarily mean you have to have surgery. MRIs have shown lumbar disc herniation material actually shrink or disappear on its own without surgery. This is called reabsorption, and it happens in more than half of all patients with a lumbar disc herniation. So there are two factors I want to talk about today that help determine whether or not your disc herniation might heal on its own. The first one is the type of disc herniation. We're going to look at four different types of disc herniations, and we're going to look at the two specifically that are more likely to heal on their own. So here you can see four images of different types of disc herniations. The first one on the left is called bulging. That's where the outer fibers of the disc have not torn. And so that nucleus, which is the center of the disc, starts to press out, but the fibers of the outer part have not torn. The second one is protrusion, where the outer fibers of the disc are starting to be pressed out, but they still have not torn. The third is extrusion, where the outer layers of the disc have actually torn and the inner nucleus is starting to escape, or it has escaped, but it's still connected to the inside of the disc. And the fourth and last one is sequestration on the far right, where you can see the herniated disc material has escaped through the torn outer layers and has actually separated from the original disc material. These last two, extrusion and sequestration, can be the most painful. Here's where it gets a little bit strange. The two types of herniation that are the worst, extrusion and sequestration, are actually the two types that are more likely to heal on their own without surgery. You wouldn't expect that because these two types of herniation are the most painful. The disc material is pressing on the nerves or it's pressing on the spinal cord, and it can be causing severe symptoms in your low back or down your legs. However, these two can heal on their own without surgery. And that's where it gets a little bit tricky. You're probably asking yourself, how would this heal on its own? In the case of extrusion, where the nucleus, the center of the disc, has exited the torn outer layers, but not separated completely, in this case, that disc material can actually retract, almost like it's being sucked back up by the disc. And at that point, your symptoms would go away. It does take time. I don't have an exact time frame for you, but that can happen. In the cases where that herniated disc material has broken off, this can actually trigger an inflammatory response where your body recognizes it as something that's not supposed to be there, and your body can actually break it down eventually to where it's gone. So that's the explanation for the MRIs that show the disc herniation, and then over time, the MRI later shows that the disc herniation is no longer there. Your body has taken care of it on its own. We talked about the two types of disc herniations that are most likely to heal on their own. Now we're going to look at the actual disc material. Okay. When the herniated material contains mostly the nucleus, which is just the center of the disc, that is more likely to heal on its own. When the herniated material contains parts of the outer ring of the disc and also parts of bone or cartilage end plate from the vertebrae, when that happens, that is less likely to heal on its own. So to summarize, if the herniated material is just the nucleus, it's more likely to heal. If the herniated material contains cartilage and fibrous rings and parts of the vertebrae, it's less likely to heal. Now, here are some scenarios where you're more likely to have surgery. If your symptoms are not relieved after 3 to 6 months of conservative care, that includes, physical therapy, chiropractic, exercise, all sorts of things. After 3 to 6 months, if the pain is still there and it's debilitating, the surgeon is more likely to do surgery. Um, if the symptoms are actually made worse by conservative care, that's another reason why surgery would be indicated. If the pain and numbness or weakness in your legs is so severe that it's causing frequent falls, that's an indication for surgery. And then there's something called cauda equina syndrome, which is very serious. It might be saddle pain, which is pain in your groin, your buttocks, your upper thighs. If there's bowel or bladder changes, or there's any sudden sexual dysfunction, these are very serious symptoms that will indicate surgery pretty quickly. So, one last thing to keep in mind, if you go over your MRI with your neurosurgeon, you may have all the signs that indicate there's a good chance that your disc herniation will heal on its own. But if you're in such pain, if you're so debilitated that you can't even function, that's going to be a deciding factor as well. You're a person, you're not an MRI. If you can't function, if you can't stand up, if you can't walk, if you can't sleep, there's just a limit to how long you can wait around for something like that to heal. So there are going to be some cases where you just have to go ahead and have the surgery. But if you can tolerate it, if there's some signs that it might heal, there is a chance. So I hope this helps. I just wanted to share all this information with you. Thanks.